Recording in
23rd
progress.
reported 638 COVID-19 related hospitalizations. That's a 45% increase over the previous week and the highest weekly total since early September. But we may be starting to see a slight slowing of Omicron's momentum. True to the recent modeling, statewide daily cases appear to have crested from the pandemic highs, offering a glimpse of hope in an otherwise bleak pandemic landscape. But as I said last week, even if cases have leveled, it will take several weeks for hospitalizations to peak and then return down to levels that are not stressing our hospital system. Our hospitals are struggling to maintain the fragile balance between providing care for people who are ill with the virus and others needing medical care. I want to once again thank every Oregonian who continues to take actions to protect themselves, their loved ones, and neighbors. The actions we take over the next several weeks will be critical to ensuring that our hospitals have enough capacity to meet the needs of all patients needing care. That means getting vaccinated and then boosted when eligible, continuing to wear a mask indoors and outdoors in crowds, and keeping our gatherings small, staying home if you're sick or if you test positive. It also means extending protective measures that were enacted earlier in the pandemic, requiring mask wearing in schools and healthcare settings, and requiring vaccinations for school employees and healthcare workers, and wearing masks in indoor settings. These rules are being submitted to the Secretary of State today, and additional rules are anticipated in the coming days for those not filed today. Our hospital system is nearing a breaking point. We are simply not yet at a point where we can consider relaxing these crucial protections. These protections are critical to protect the residents in our long-term care and congregate care facilities and our healthcare workers. These protections are critical to ensuring that our school-aged children, their teachers and staff can conduct in-person instruction every day. These measures will not be in place forever, but they are needed now. As we have throughout the pandemic, we will continue analyzing the data and develop reasonable metrics and a thoughtful process for discontinuing these measures when it's safe. Public comment on the general mask rule for indoor public spaces is still being reviewed. Let me close today by talking a little bit about booster doses. As has been clear for weeks now, we will fall short of our goal to get 1 million additional Oregonians a booster by the end of January. The purpose of setting the goal was to promote the effectiveness of boosters as a shield against the Omicron variant. While it is disappointing to fall short of the goal, we have good news, and that is that nearly 500,000 Oregonians have taken the opportunity to receive a booster. Thank you. That's nearly 500,000 people who are better protected themselves from the virus. Thank you. Nearly 500,000 people who are far less likely to spread the disease to others. Thank you. Nearly 500,000 people who now are far less likely to occupy a critically needed hospital bed because of the virus. Thank you. The goal that we all want to attain, an end to the pandemic in Oregon. Let's look at how our state compares amongst US states in vaccinations and boosters, according to the CDC data. We're 10th among all states in DC in percent of total population, children and adults, who are fully vaccinated and have received their booster dose. We're also 10th in the percentage of people 18 and older who are fully vaccinated and have received a booster dose. We're 12th amongst that same group in the percentage of people 65 and older who are fully vaccinated and have received a booster. And our total vaccination dose rate is 18th best amongst states in the District of Columbia. My thoughts go out to all the Oregonians who are battling this virus, those worried about family members in the hospital, and those mourning the loss of a loved one. The pain of COVID is still great, but we can all do our part to blunt this newest surge by continuing to wear a mask, staying home when we're sick, getting vaccinated, and when it's our turn, by getting a booster shot. And with that, I'll be happy to take your questions.
Thank you, Dr. Sidelinger. Our first question comes from April with Oregon Public Broadcasting. Go ahead, April.
Hi, thanks for taking my question. Can you hear me okay?
Yes.
Great. I was just wondering if crisis standards of care are going into effect anywhere in the state, and if there's anything more the state can be doing to help ease that crunch.
Thank you. As of right now, we don't have healthcare systems that are using crisis standards of care. We are doing everything we can as a state, as healthcare systems, to bring additional staffing resources to hospitals and to our long-term care facilities. And right now that seems to be meeting the need, along with the current staff, and doing additional testing so that folks can return safely to work and caring for patients as soon as they can after recovering or after being exposed.
Thank you, April. Our next question comes from Lisa Balick with Coin News. Go ahead, Lisa.
Yes, good morning. Dr. Sidelinger, you mentioned about revisiting the indoor mask requirement. Is there a timeline for that? Meaning in terms of any kind of specific metrics? In other words, you've mentioned before, obviously you look at hospitalizations, you look at number of positive cases, but is there anything a little more drilled down to give people some sense as to, could it be next month? Would it be April? Some better sense of where that's going.
Thank you for that, Lisa. A little recap on where we are with these rules. I anticipate today, if it's not already filed, that the school rules around masking and vaccination for teachers will be filed early next week. Similar rules I would anticipate filing for healthcare settings. The public comments are still being reviewed for the general mask rule, but I would anticipate that will be done by the end of next week, and likely we'll have some next steps for that. In terms of when it is time to stop wearing masks, that measure hasn't changed. We need to look at the number of COVID-19 positive folks in the hospital who are receiving care, and the impact on the ability of hospitals to provide care. What we know right now is that those numbers are still increasing, but are anticipated to peak soon, within the next week to week and a half, and then are anticipated to come down rather quickly. This will happen quicker than the Delta surge, as the length of stay, the amount of critical care needed for patients is less. So I would anticipate that in the coming weeks to month and a half, that we will see a significant decrease in the number of people with COVID in the hospital. And at that time, it'll be a time to start talking about, can we move from a requirement for masks in indoor public places to a recommendation for certain populations or in certain communities where the rate's higher. So right now, as we are still facing the onslaught in our hospitals with increasing COVID, is not the time to relax those, but this is not a forever. And I would anticipate it's really in the coming weeks to at most a couple of months that this requirement would still be a necessary tool that we'd need to use statewide.
Thank you, Lisa. Our next question is from Brian Anslinger with K2 News. Go ahead, Brian.
Thank you, and thank you, Dr. Sidelinger. Question, how concerning is it to see more kids ending up in the hospital because of COVID-19? And is there a plan already in place for OHA to distribute vaccines for children under 5, presuming approval comes through soon?
Thank you. I think it's always concerning to see an increase in hospitalizations, whether amongst children or adults, but that's especially true amongst children. Children are still protected from the ravages of COVID-19 compared to adults. We've seen much lower hospitalizations, serious complications, and deaths. But as cases have increased significantly during Omicron, we are unfortunately seeing the number of children being hospitalized increase as well. This is probably due to several factors: the increase in cases in general, the fact that children still remain unvaccinated, with the youngest children not being eligible for vaccines, and with the Omicron variant impacting the upper airways more than the lower airways in the lungs. And this often causes more respiratory difficulty, breathing difficulties for young children. So I think that's what we're seeing right now. Children appear to be, the children who are being hospitalized appear to be receiving care and being discharged at the end of that. But this number is always distressing to see. And it's especially distressing for the children and their families who love them, who are worried about their care. So this number is not all that surprising, but we hope to see that come down as the general hospitalization numbers come down. As far as vaccinations for younger children, we are actively, watching the data and watching our federal partners, as we would anticipate approval sometime later this year for vaccines for younger children. As with the vaccine that were available for younger children earlier in the pandemic, we will continue to work through multiple channels to have those vaccines available for parents for their children. We anticipate use of our pediatric health professionals and other primary care providers to deliver many of those vaccines. May have those vaccines available in pharmacies and other locations where we have providers who are comfortable vaccinating younger children. And we will likely have some community-based events where younger children and the whole family can get vaccinated. So we'll use those multiple avenues, and we stand by waiting to see the data, to see the safety and effectiveness data. And if that shows a recommendation is made for this younger population, we'll be ready to vaccinate these younger children.
Thank you for the question, Brian. Our next question comes from Gary Warner with EO Media. Go ahead, Gary.
Hi, Dr. Sidelinger. Thanks for taking my message, and hope that Director Allen recovers swiftly. I was wondering your thoughts on the letter that a group of physicians sent to President Biden regarding moving towards a more towards like dealing with this as an endemic problem rather than a pandemic problem, rather than trying to eradicate, trying to live with this virus. Just your thoughts.
Yeah, thank you for that question. Thank you for sending on those thoughts for Director Allen. You know, I agree with the sentiments in that letter. I think we'd all like to move on to a phase where we can live with this and it's not dominating our lives, not causing kids to be home from school, causing us to scramble for childcare plans at the last minute, and not swamping our hospitals. A disease being endemic does not mean we've eliminated it. It means we need to live with it, but it's not causing massive surges that interrupt day-to-day life. Unfortunately, we're not there yet with Omicron in Oregon or most other states across the country. We have over 1,100 patients in the hospital right now with Omicron in Oregon. You know, we have hired healthcare workers who are providing the care for them and the other patients that are there. We still see some impacts on businesses and schools and childcare providers because of large numbers of employees who are sick and needing to move to remote settings or close down temporarily. So I think as we continue to have people vaccinated and boosted, as we get over this current surge of Omicron, unless there's another variant on the horizon, which right now there's not, we should be able to move into a phase where the disease is in our community. We live with the disease, but it's not causing these disruptions to daily life, and we live with it. There will be times when the disease rears up again, similar to influenza on a seasonal basis, and we will have to get through that. But right now, the large number of cases, the large number of people who are hospitalized means we're not there yet. But I hope we will be soon, and I hope we can enjoy a spring and a summer where it is much more normal, where it's much more like 2019 and not like 2020 or 2021. Safe and effective vaccines are available. Many Oregonians have gotten them at higher numbers than most other states, and that's going to help us get through these next months and these next years as we live with COVID-19 instead of having our lives dominated by it.
Thank you. I have another question, but I'll let everybody else go around first.
Okay.
Thank you, Gary, and thank you for your thoughts about Director Allen. We appreciate that very much. Our next question comes from Kendra Kent with KPTV. Go ahead, Kendra.
Hi, good morning. I have two questions. Can you guys hear me?
Yes.
Yes. Okay. One, I wanted to see if you could talk just a little bit about COVID treatment. We've had people reaching out to us saying that they've been unable to get some of the treatments, you know, at their normal healthcare provider. And it, of course, seems like, of course, you would get, you know, some of those treatments in the hospitals more, but with more people in the hospital now, what is the status on the different COVID treatments like the remdesivir and the antibodies?
Thank you for that. Unfortunately, you know, our treatments are still in very short supply. We have a monoclonal antibody treatment that is still effective against Omicron, and that is in very short supply. It needs to be delivered usually in a hospital setting because it's an injection, but it's not as available as we'd like. We have oral pills now, antiviral pills that are effective against COVID-19, including the Omicron variant. But again, those are in very short supply, have been distributed to our healthcare partners so that individuals who are at risk for complications from COVID-19, have underlying conditions, or are elderly can receive a test, and when they test positive, receive those pills. We hope that supply chains will open up in the coming weeks, and we'll see more of that. So that can be an additional tool, along with our vaccinations and boosters, along with wearing masks, staying home when we're sick, that can help limit the spread here in Oregon and limit the impact on hospitals as they can prevent the complications. But unfortunately, right now, we're limited by the supply of those medications.
Thank you. Just one more very quick question. In terms of hospital staff, a couple weeks ago being out in big numbers, are we seeing that ease a little bit? Are we seeing that they're not dealing with quite as many staff shortages among hospital workers?
Thank you. While we don't have a systematic way to kind of, assess every healthcare worker who's out due to illness or due to exposures, I think, we aren't hearing of quite as many staff who are out, but certainly we have a significant number of staff in our healthcare facilities and our long-term care facilities who continue to be directly impacted by COVID. And that's why we've been working with the National Guard to help provide support in hospitals, as well as several contract organizations to bring additional staff in, try and fill in behind those staff who are out, as well as provide care for the increased number of patients who are needing it right now, with over 1,100 patients with COVID in the hospitals right now. So yes, staff illness and staff absence due to COVID is still an issue, but it does not appear to be significantly worsening at this time.
Thank you.
Thank you for the questions, Kendra. Our next question comes from Pat Doris with KGW. Go ahead, Pat.
Thank you. I may be the only knucklehead who doesn't follow along here, but Dr. Sidelinger, you mentioned things being filed with the Secretary of State, I think on two different types of maybe mask rules. Could you say what those are and why do they need to be filed with the Secretary of State?
Thank you, Pat. As many people are aware, we've had several temporary rules in place that have helped us to combat COVID-19. These include temporary rules for staff and teachers in K-12 settings to receive their vaccinations and be fully vaccinated to teach and work in our schools. Similar requirement in our healthcare settings for the staff in hospitals, other healthcare settings, and long-term care facilities. We have temporary rules that require the use of masks in K-12 settings and indoor settings, as well as mask use in our hospital and healthcare settings. And then another temporary rule that governs mask use by the general public in indoor public settings. As those temporary rules expire, we've gone through the permanent rulemaking process to institute rules that will help us get through this current surge. Today, after receiving public comment, both in virtual hearings as well as written comment, we've reviewed those comments for the school mask rule in K-12 settings, as well as the school staff vaccination rule. A report will be filed to include responses to those comments with the Secretary of State so that that rule can remain in place past tomorrow, as our temporary rule expires tomorrow. I anticipate being able to finalize a report on the healthcare settings, both the vaccine requirement as well as masks in the coming days, and would anticipate a filing for those rules early next week. Public comments are still being reviewed in response to the mask wearing in indoor public settings for the general public, but I would anticipate some action on that rule in the coming week. So each rule, when it becomes effective, the report and the rule language is filed with the Secretary of State so that that can be in effect here in Oregon. A similar process was followed for the temporary rules, and that's just part of the process as we implement these rules to help us continue to fight this pandemic here in Oregon.
Thank you for the question, Pat. Our next question comes from Sarah Klein with the Associated Press. Go ahead, Sarah.
Hi, yeah, I had a question about the indoor mask rule. So I know it's still under review, but if you guys do go forward and it's implemented, I know you said you're hoping that it'll be lifted once hospitalizations go down and stuff, but if there is another variant down the line and the rule is lifted and you want to re-implement it because health officials see it fit, what is the process of that?
Thank you for that question. I think, we will continue to review public comment and assess the filing for this rule. And we'll also, assess what metrics, what specific data points can we look at, or what timeline can we look at to anticipate rescinding this rule based on what we're seeing right now with the current Omicron surge and what's on the horizon. Right now, there's not another worrisome variant on the horizon. Our vaccines continue to be effective, and our oral therapeutics, while in short supply, work against Omicron, and we anticipate having more of those. If a future variant comes into Oregon, into the United States, that is causing more severe disease, I think you'll see public health recommending masking in more settings, even if the requirement is not in place. If the rule is rescinded, it could be reinstated based on local conditions. But what I would anticipate is moving to a recommendation phase because of the other effective tools that we have. Temporary rules, governor's executive orders were used early on in this pandemic to respond to this. But as we moved into a more long-term response, we're using our permanent rulemaking process to keep these tools going so that we can maintain hospital capacity, get through the surge, and get to a place where we're not wearing masks in most settings, where we're not seeing impacts on businesses being able to operate because their staff are out ill, where we are living with this disease and not facing this disease every day as we leave our house.
Thank you for that question, Sarah. Our next question, Dr. Sidelinger, was submitted via text, so I'll just read it. It's from Angelina Dixon with KVEL News in Eugene. And you did touch on this a little bit, but just asking the question here. She noticed there that we are in a downward trend in terms of cases. Do we see this trend continuing? And also, have we peaked yet in terms of Omicron?
Thank you for that. I think what we see overall in our statewide cases, we appear to be at a plateau, maybe slightly decreasing. While we know that those reported cases are not all cases because most home-based tests are not reported to us. Those who don't seek a test aren't reported to us. I do think that plateauing, the potential, beginning of a decrease is real. What we're seeing in the Portland metro area that was hit first by the Omicron surge is that cases appear to be going down in the Portland metro area counties. Those are all good signs, and all signs that the actions Oregonians continue to take, getting vaccinated, boosted, wearing masks, staying home when they're sick, rescheduling plans for a time when COVID is not surging, are making a difference. Our forecasted peak has gone down several times in our forecast as we've learned more about the Omicron variant, but really as we've looked at the behavior change that Oregonians have made to combat this virus and to save our hospital system. So yes, I think we're kind of at or near that peak of cases right now. We appear to be maybe kind of just over that peak in the Portland metro area. Other parts of the state are still seeing an increase, and our hospitalizations are still increasing. So I want people to focus on that good news. We're making a difference, but also know that now is not the time to let up our guard. We saw a massive number of cases occur as we came up this peak, and we're going to see that same massive number of cases occur as we go down the peak. But we can see that light at the end of the tunnel. We're closer to being able to be in a place where we're living with this virus rather than combating it and fighting it at every turn. And that's really thanks to the hard work and sacrifices that Oregonians have made.
Thank you for that question, Angelina. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thank you. So how many people are hospitalized right now in Oregon with COVID-19, like the latest numbers for today?
So I gave you the numbers, Trish. I don't have the numbers in front of me for today. Let's see. I think today we'll be reporting 1,125 Oregonians in the hospital. That's 5 fewer than we had yesterday, and 176 COVID positive patients in ICU beds. That's up 7 from yesterday.
Okay, so with OHSU's forecast of 1,550 hospitalization at the peak of February 1st, is Oregon still gonna hit that peak, or have you revised the peak downward?
Again, I haven't seen revised forecasts this week, but in talking with Dr. Graven at OHSU and looking at the latest data, that peak may be slightly lower. I think we still anticipate reaching that peak of COVID-19 positive patients in the hospital at the beginning of February, which is really just a week to potentially a week and a half away. So I think we are going to continue to see overall daily increases in this number in the coming week, but hopefully there we'll hit our highest point and start to see that number going down, start to see less people needing that care, less families that are concerned and anxious about their loved ones, and less stress on our healthcare workforce as they care for these folks. But yeah, I hope that with the data trends we're seeing, we may see that peak even a little lower than the most recent projection.
So just to follow up real quick, but to hit that projection right now, it would take more than 70 new hospitalizations every day. So given we dropped 5 since yesterday, I mean, is there any indication the peak might be substantially lower than what was previously projected? Thank you.
I think, getting certainty into the forecast, of Omicron, of any of the variants of COVID has been tricky. I do think we're going to continue to see increases, hopefully not reaching that peak of 1,500, but we have seen some pretty dramatic daily increases in hospitalizations during this rise. The slope of this increase has been rather steep, even steeper than that in Delta. So, we could have a few very bad days in front of us, but I anticipate a revised forecast coming soon. We are watching that data closely. What we know is that other parts of the state that are now seeing increases in reported COVID cases are parts of the state with lower vaccination rates that have populations that may skew older. And so we may see slightly increased hospitalizations compared to cases in those regions, and that's accounted for in our forecast.
Thank you for those questions, Fedor. Our next question is a follow-up question from Gary Warner, EO Media. Go ahead, Gary.
Hi, yeah. One of the anomalies that I've noticed is the number of high cases per capita in Deschutes County, a county that has a very good vaccination level, but still has been number 1 or number 2 for much of the past 6 weeks. Do you guys have any idea about why that's happening there?
No, and I think we've seen this pattern with Deschutes, in previous surges as they came in, that Deschutes has often had higher case rates than we would anticipate based on their vaccination status. Some of this can just be due to the density of population, with Bend being more densely populated compared to many of their neighbors. Some of it can be due to people who may spend part of their time in Deschutes and part of their time in other counties, have a residence in Deschutes, and when they test positive are there. But certainly we have seen increased cases and increased hospitalizations there. And that's, out of proportion to their vaccination rate. We know that many of the counties around Deschutes have significantly lower vaccination rates, and that may also contribute to spread, but we don't have a definitive answer of why we see that discrepancy in that county in particular.
If I could ask one quick follow-up. Washington State and Idaho are both showing high rates of increase. Sort of they're late on the curve. Idaho, which I think was way down at the bottom about 3 weeks ago, is now near number 1. What is the ramifications for Oregon?
Yeah, I think, we know that, COVID doesn't stop at borders, whether those are international borders, state borders, or county borders. And certainly as we see increased disease in communities around us, that can certainly lead to more disease, in Oregon. Oregon and Washington, which have had similar approaches to combating COVID-19, have also seen fairly similar cases and patterns in case distribution. Washington's cases have been higher than Oregon throughout much of this Omicron surge, but we're following similar patterns. Idaho with significantly less, vaccination overall than Oregon, has had different patterns and oftentimes much higher surges and much wider peaks than we have. So certainly, in our border communities that have significant travel back and forth to other states, if their rates are higher, I would encourage Oregonians to continue to heed precautions when they're visiting businesses, friends, families, acquaintances in those locations. I continue to recommend getting vaccinated and boosted when you're eligible, because those kind of activities will provide you the greatest protection, even if you're in communities where Omicron is spreading at a higher rate than it is in your home community.
Thank you.
Thank you, Gary, for those questions. Our next question comes from Kendra Kent. It's a follow-up question. Go ahead, Kendra.
Yes, this last question is actually a little bit different. You talked about the light at the end of the tunnel, and we've been hearing that for so long now. What can you share about trends in suicides, how you guys are tracking that? What have you noticed? What can you report to us now that we're like 2 years into this?
Thank you for that. The impacts on our mental health, our social emotional health have been tremendous during this pandemic, both from the disease itself, the anxiety and fear caused by that, the losses that many of us have suffered, the social isolation that happened during lockdown and continues to happen for many people who can't access services. When we look at suicide deaths, during this pandemic, we have not seen large increases when we compare those numbers in 2021 with the preliminary data to 2020 and 2019. We do know that visits for mental health support, visits for suicidal ideation to our emergency departments and urgent cares have increased, and that there's a stress on obtaining the critical mental health services that people need. This is an exacerbation of access to care issues that were in place before the pandemic. So certainly we have seen impacts on mental health. Luckily, we're not seeing the increases in suicide that many people feared, but we are working on doing what we can to increase our mental health care capacity, link folks to appropriate services, because we know the impact of the pandemic, the indirect impacts of the pandemic have been extremely hard on all of us, children, adults, and everyone throughout Oregon and other states.
Thank you.
Thank you for that question, Kendra. Okay, this appears to be our last question. This question comes from Lynn Terry. Go ahead, Lynn Terry.
Okay, yes, I'm unmuted. Thank you. I was panicking that you weren't going to call me. Not a big question, but I'm curious about a couple things about hospitalization and Northwest Oregon, which was hit the first. And right now, Northwest Oregon down through Benton County, Lynn County, they have the biggest squeeze on for adult non-ICU beds. And so you said that, cases are starting to level out, but that hospitalizations will increase. So I'm wondering, one, are there plans to increase staffing in these hospitals, which appear to be getting overloaded right now? Or two, could we reach an unusual situation in which the metro area, for example, would be sending cases, to rural counties, for example, or Central Oregon or Southern Oregon?
Thank you for that. So our hospitals, really do work as a system across Oregon, and particularly in times of surges or increased patients, that becomes critically important. Typical hospital referral patterns, they will have hospitals that they refer to. There are often referrals to tertiary centers within regions and more specialized care that may be accessible in urban areas or in the Portland metro area. Transfers occur from across the state and even from other states. While cases are just now looking like they're coming down here in the Portland area, the hospitalization numbers do lag in that. So continuing to see significant impacts on hospitalizations in Northwest Oregon is not that surprising. We're also continuing to see cases increase in the throughout the rest of the Willamette Valley, and those cases do not appear to have plateaued and are not coming down. Hospitalizations, unfortunately, are going to continue to increase in the Portland area and likely across the state in the coming days and weeks. And we have been working very hard to get staff to those hospitals in the Portland metro area, in other areas, and across rural Oregon. We have multiple avenues that hospitals have requested staff. We have staffing agencies fulfilling those requests regularly with close to 1,000 staff on the ground, and likely over that number to be assigned within the coming week. We know that our National Guard is supporting non-clinical activities in many of those settings, and those staffing supports will continue to increase in Portland, in rural Oregon, and other places across Oregon as we continue to see an increased need. We hope that the need will not outstrip our supply of staff, because staff, supplies, are limited. And for now, it appears that we're able to get that hospitals through this crisis. And that's thanks to the hard work of all Oregonians in taking steps. But we need you to continue to take those steps to limit the spread now, as our hospitals are about to face their most severe crisis.
Thank you for those questions, Lynn. We actually do have a couple more questions. We have a follow-up from Fedora Zarkin, which I will get to you in a second, but one was submitted via text, Dr. Seidlinger, and it was, what are the current death trends right now?
Yeah, what I said, we know that reporting of deaths can be lagging, and death is a lagging indicator. So I'd anticipate, unfortunately, that with the large surge in cases we've seen and the large number of hospitalizations, that we're going to see deaths go up. Luckily, the rate of death from Omicron is much lower than it has been from previous variants. But unfortunately, just due to the sheer volume of cases that we are currently seeing and that we will continue to see in the coming weeks, we're going to see death numbers remain relatively high for some time here in Oregon.
All right, thank you for answering that. Our final question it's a follow-up again from Fedora Zarkin with the Oregonian. Go ahead, Fedora.
Hi, thanks for taking my follow-up. So I just want to ask, so if we see another 100, 200, 300, 400 more people actively hospitalized, if we reach that peak or whatever the revised peak will be, will that be demonstrably different than what we have now in a way that will significantly impact the healthcare system, like more than it already is?
I think so. What we have to remember about our healthcare system is even during non-COVID times, there's limited capacity to surge. We want to do what we can to keep people healthy, and we want to have hospital beds available for the people who need them. So our hospital system is able to flex to meet those. We've been facing COVID-19 for 2 years now, and unfortunately, the last months have been the most difficult. During the Delta surge, an incredible number of folks were hospitalized, the folks needing intensive care, ventilators, and even ECMO, specialized machines that oxygenate the blood, were at the highest levels we've seen throughout the pandemic. Those numbers in the hospital were still coming down when Omicron was first detected in November and started to spread here in Oregon in December. So our healthcare workforce is extremely tired from having dealt with this for over 2 years, from having come down off the most severe peak into an even more severe peak. We know that healthcare staff are impacted still by COVID-19, have caretaking responsibilities because of daycare that's closed or schools that are closed or other relatives or folks that they need to care for who have COVID-19. And we know that we're continuing to see higher numbers of folks hospitalized. And so all those things are going to impact the ability for our hospitals to absorb 100 more patients or 200 more patients. And that's why the steps that Oregonians have taken in the last few weeks as Omicron came into Oregon have been so critical. 500,000 people receiving boosters from the end of December to now is a great help. Those are people who are protecting themselves and those around them. People who continue to get their first doses and second doses, that's a great protection. Continuing to wear our masks in Oregon has one of the highest reported mask wearing in indoor public places amongst states. That continues to limit the spread. We've seen from survey data that individuals are limiting their activities during this time of surge. That continues to limit the spread, and that's all helping to get this curve down. But it takes all of us together to support those healthcare systems, and I think we will get through this together. I'm anxious to see what the data holds in the next week or two and what the new forecast shows, but we are seeing some slowing down here. I think with that, Erica, would you like me to wrap up?
That would be great if you wanted to offer some closing remarks.
So thank you all for being here. I know, this may seem like very similar comments that I've given in the past, but we really are seeing progress here in Oregon. The Omicron variant has ravaged across the state and is causing hospitalizations to be very near where they were at the peak of Delta, and I think we will soon overtop that. Oregonians have stepped up to get their vaccines, have stepped up to get their boosters at rates not seen in other states. We continue to take measures to protect ourselves and those around us. We're wearing our masks regularly when we're indoors. We're rethinking our plans during times of surge. And I think that all of those things put us that much closer to, in the coming weeks, in the coming months, to being in a time where we can think about living with COVID rather than having it be so daunting in our lives every day. To the Oregonians right now who are sick and recovering, my thoughts are with you. To the family members who are caring, for their loved ones, helping them out while they recover, my thoughts are with you. To those who have a relative in the hospital that you're worried about or anxious about, my thoughts are with you. And for those who've recently lost someone to COVID-19, my thoughts are with you. COVID-19 continues to take a huge toll on us. It continues to cause anxiety and fear, but together we'll get through this, and that getting through this is going to happen sooner. We're seeing that progress now, and I thank you for all those steps. Have a great weekend.
Recording stopped.